Well, good morning or good afternoon. This is Dr. Darvish here from Holy Speak, joining you live. Thank you so much for being here with us. Today we have a special doctor joining us, Dr. Newell, who's been with us for a couple of years almost now. And his specialty is men's health amongst injection therapies and other types of therapies. We're talking about Movember Men's Health Month. And I'm just going to wait for Dr. Newell to join me. Here he is on Facebook. Can you request to join me on Instagram? Let's see if you can find me on Instagram. And
yes, I see you now.
We can get this chat moving on. So this is a very, very exciting conversation because, men, you are important and we need to address your health concerns.
Okay, request
sent. So here is Dr. Newell on Instagram as well. Welcome, welcome, welcome. Welcome, Dr. Newell.
Well, hello.
Good to see you. How are you?
I'm doing good. How you doing?
Good. This will be fun to do this.
Yeah.
Yeah? Okay, so tell me about Movember, because Movember is your ticket, isn't it?
One more time, I missed you there.
I said, tell me about Movember.
Oh yeah, so well, hello everybody. First and foremost, I'm trying to get this back and forth action down here. But hello everybody. Is everyone doing good? So just talking about Movember just a little bit. So what is it? Basically, it's an annual event that's held every single year in the month of November. And its main goal is to raise awareness about men's health issues, specifically prostate cancer, testicular cancer, and also mental health, which is a big piece of it as well. And the goal of all this is the idea is to create change, right? And give men the opportunity and confidence to learn and talk about their health and to also take action. So this is a special topic to me, and I feel like I'm being put on a platform here, and I can speak to men everywhere and help motivate them to start talking about their health and take charge of their health.
Well, I'm so excited to have you with us, Doc, because men need to hear it from a man, right? And I can talk as much as I want to, but I sometimes feel like as a woman, it's not as heard. Because men feel like they can't relate really to a woman as much as they can relate to other men. So I'm glad that you're here. And one of the big topics is actually prostate cancer that
yes.
we're talking about today, right? And this is very special to me and to my heart. In fact, I really want to dedicate, if I may, this episode to my father-in-law, who passed away about 25 years ago. And he was diagnosed with prostate cancer 30 years ago, at the very beginning of the time that I was just in my first or second year in school. And my husband and I got engaged, and he was diagnosed with prostate cancer. And then he decided to go for radiation. And this is in Vancouver, Canada. So they told him, radiation is the way to go, and there's 1% chance that it might spread to other parts of your body, 1%. So he decided to go for the radiation. And then before you know it, within a couple of weeks, he was experiencing severe back pain. And so he went back in, and sure enough, the cancer had spread to the bones. And then they told him he's got 3 months to live. And, you know, being a new student in school, I really had no idea about what cancer really involves, a holistic perspective, none of that. So I did find Dr. Chen over in Vancouver, who was doing a lot of naturopathic oncology, and he was willing to see my father-in-law. And so he started seeing him. And even though he didn't really follow the regime completely, it was kind of haphazard with the diet and the supplements, he did thrive. And I say thrive because he had the energy and the willpower and the strength to go traveling to Europe to visit his daughters. He had a chance to go to Israel, to the Holy Land, to visit all the Baha'i shrines there and meditate. And he really had a chance to live a fulfilling life during the last 5 years. So instead of 3 months, it actually ended up being a thriving 5 years. And that was my introduction personally to not only prostate cancer, but generally to cancer. And since then, I've just been working with different people in my life, patients and family members with cancer. So it's a very special discussion that we're having because it is very close to my heart. So thank you for joining me and exploring this concept of prostate cancer and men's health, because there is a good chance that we can reduce risks of cancer in men, especially when it comes to prostate cancer. Would you like to start off talking about a little bit about prostate cancer and the risk factors, Doc?
Absolutely. So just to hit you with a couple more facts and then one more tad bit about Movember. The mustache is kind of taken on the symbol of the forefront of this movement, and mine is, as you can see, is not the greatest, but I do what I can. So just hit you with a couple quick facts about prostate cancer in general. So 1 out of every 9 men will be diagnosed with prostate cancer during their lifetime at some point. Just a couple other facts here. The average life expectancy for men in the U.S. is almost 5 years less than women. About 15 million American adults would be diagnosed with depression each year. More than 1/3 of adults in the United States are obese. And about 12.1% of men 18 years and over are currently in fair or poor health. So we need to start having this conversation, and hopefully the younger generation is listening and tuning in as well, but having this conversation about taking charge of their health, because this is a serious issue.
Yeah, those numbers are astounding, right? But there's something we can do about it. And that's really why we are having this conversation, is because men and women helping men, and together we can really help shift those numbers, reduce risks. And it's not just about reducing risks, it's actually about optimizing well-being. You know, personally, I don't want to be suffering. I don't want my husband or any other men around me to be suffering as they get older. I want them to live vital and thriving lives and live their purpose, right? Mentally, absolutely, emotionally, physically, live their purpose. And that means really trying to take care of ourselves when it starts as young as possible. Changes in the system happen way before cancer is diagnosed, way before heart disease and diabetes is diagnosed. It doesn't happen overnight. And it's those tiny little shifts that we can have an impact, we can have control over it, that makes the difference for
Absolutely.
us. And, you know, and I love seeing you around the clinic because I see you living that example. And so I think maybe that's somewhere we can start, is for you to share with us, what do you do to reduce your risks for some of these chronic diseases and cancers?
Yeah, absolutely. I try to live and lead by example. I think that's important. And hopefully men look up to that in some way, shape, or form, and encourages them to take action as well. But just going with the basics right off the bat: exercise, eating right, eating a well-balanced diet, lots of fruits and vegetables, low inflammatory foods, and then just stress management. That's a huge part of it as well. So we'll get into it a little bit later, but I have my supplements and my herbs that I take and all the fun things, but it starts with the basics.
It really does. It really does. And I think one of the things that I find that you're really awesome at is emotional control, right? And it's not really emotional control just because you're numbing it, you're actually letting it go. And And the emotions, we talk very little about emotions and mental health with men, but it has a huge impact on the well-being of men, their prostate health, their physical well-being. And we'll get into that next week a little bit more. But that's one of the examples that I see you setting, is you're really letting go of any drama that comes at you, and, you know, working with, I don't know how many women around you here at the office. You're doing a really good job, Doc.
Oh, I appreciate that. I try to live a stress-free lifestyle. So,
well, it starts here, right?
Yeah, it's all in the mind. Absolutely.
It's all in the mind, and if we can transform this, then you can transform it into your lifestyle and well-being as well.
Absolutely.
Okay, so where do you want to go next? Do you want to talk about prostate cancer's symptoms, or where do you want to go?
Yeah, I'll hop into the symptoms here, more about prostate cancer in a second, and just a little bit of information about the prostate. But going back to, I just want to touch on a few issues and maybe reasons why men are in such a poor state of health currently in the United States. One of the first and foremost that when I was researching and looking into it, it's just a general lack of awareness. And that just not understanding the health issues and the seriousness of the health issues that are at the forefront of men's health right now. And also, I don't know if it's a social thing, but the men are not openly discussing their health and how they feel. There's also a reluctance to take action when men do not feel physically or mentally well. Men typically engage in more risky behaviors and activities that also threaten their health compared to their female counterparts. There's also a lot of stigmas around mental health, and I know we're going to focus more on the prostate cancer end of things today. But I want to, are you guys getting feedback?
I'm not. I'm doing okay.
Okay, just wanted to double check. There's a lot of stigmas around mental health, and I just want to, that'll be touched on more last week, but, you know, start the discussion that it's okay to share emotions and feelings and take control of those as well, and seek help. But an interesting stat I also came across are men are about 24 less likely than women to have visited a doctor in the last year, which is staggering. That's 1 out of every 4 men essentially. So we need to create this awareness and have this forum and discussion for men to learn and take action.
You know what, Dr. Newell, though, I am very impressed by the men in our practice. I think about 25 years ago when I initially started practicing, that maybe 1 out of 500 women that I would see. And now it's at least a third of the clients, patients that come in here are men. And not all of them are coming in because they're sick. They're coming in because they want to take care of themselves. And that is so exciting to see, because they're setting examples for their sons and grandsons to start taking care of themselves.
Absolutely.
Yeah. So it's really awesome to watch that transformation as awareness increases.
Absolutely. And just starting with a conversation is all it takes.
Yeah. So it's good. So what are some of the symptoms of prostate cancer that we should be aware of? Yeah.
So basically, just a little bit about the prostate first and foremost. It gets larger as you age. Typically, it's around the size of a walnut. And it typically, like I just said, it grows bigger as men get older. The prostate gland actually surrounds the urethra. And it's the tube the urethra is the tube that men urinate and ejaculate through. The function of the prostate is actually to produce some of the fluids containing your semen, which is essentially a transport for the sperm. So just a little function around what the prostate is actually doing, the prostate gland is actually doing. And then some of the risk factors when you do have prostate cancer and some abnormally forming cells, some men can experience, well, first and foremost, I should say, not everyone experiences symptoms of prostate cancer right off the bat. And some may never actually experience symptoms unless it's a more aggressive or more severe case of prostate cancer. But the symptoms are the need to urinate frequently, especially at night, difficulties starting urination, weak or interrupted flow, painful or burning urination, there could be some difficulty obtaining erections or erectile dysfunction, Ejaculation can be painful. There could be some blood or sometimes the blood and semen. And then really obscure, but you see it from time to time, some back or hip pain you can also see with symptoms of prostate cancer.
So it's really also important to know that those symptoms are super common amongst men. And that doesn't mean that if you do have urinary issues, dribbling, hard time starting or stopping, or discomfort with urination or frequency or waking up at night, that you have prostate cancer. I don't want men to go there, right? Because those are very common symptoms of actually the prostate enlarging. And so it doesn't necessarily indicate that you have cancer, but it indicates that you should get it checked out. And getting it checked out involves at least getting a PSA marker, which is not a very good marker. It can fluctuate very quickly with different conditions and inflammation within the body. So it's not the best one, but it gives us kind of a general concept of what may be going on. And getting a digital rectal exam, which is measuring basically the size of the prostate, and feeling to see if there is any hard nodules or any shifts in the texture of the prostate. And so it is really important to get that checked out just to be sure. Now, one of the findings that I find on tests is low testosterone. That men who have low testosterone have a higher risk for prostate cancer. And it's interesting because when you find somebody, a male come in whose father, like my husband, whose father had prostate cancer, and you find the low testosterone and you correct that testosterone levels, that their risk for prostate cancer tends to go down. Now, it doesn't mean that you overshoot for the amount of testosterone, because too high of testosterone or too low both can increase the risks for prostate cancer. So it's really getting to that physiological norm, which is what we see with, 20-year-olds. Nowadays, though, we do see low testosterone in young men, and we need to address that. But really looking at a physiological normal levels of testosterone, which we typically want to be over 550 in the blood.
Yeah, and I think you did a good job of mentioning that, PSA is currently the gold standard, or the conventional model of how we're measuring prostate and prostate health. It's just really just a simple blood test. But if we can track those numbers over time, that gives us a set of data points. We can get a better picture of what's actually going on inside the man's body. So exactly. Super important. It's also age dependent. So we have to take both of those factors into account. If your doctor isn't talking about this, you got to find yourself another one.
Yeah. Yeah. And, the other thing about this is we talked about that enlarged prostate, which is the term of it is BPH. Diagnostic term is either BPH or benign prostate hypertrophy. Enlargement of the prostate is very common even in young men, like even in 35-year-olds and 40-year-olds. And one of the links that I have seen to that is relationship issues. If men are having issues with their relationships, and men tend to be a little bit more closed off in terms of expressing their needs in a relationship, and they hold on to it. And when they do that, what I've seen is that they have to express it somehow. And because the pelvic area is related to emotions and relationships, that oftentimes we're harboring those emotions in the pelvic area. And then because you're not expressing it, it causes an enlargement of the prostate. The prostate energetically becomes weaker, and then it enlarges. So it is vital for every man to learn how to express themselves in a relationship. And if they're not getting their needs met, they need to talk about it somehow, somewhere to someone, so to reduce those risks.
Absolutely. Treating the whole person is
exactly treating everybody.
But just hitting on the PSA score, or just PSA test a little bit more. what to do and when is the most important question, and a common question that men have, especially about their health. They've heard about PSA, but they don't really know what to do with it. So I'm going to break that down for you. So 50 years old, you need to start having a conversation with your doctor about PSA testing if they haven't already brought it up. A couple other facts that I found interesting. If you're African American, 45 years old, we need to start having this conversation and start doing some testing. Also, if you have a family history, brother, father of prostate cancer or any large prostate BPH, you need to start having that conversation immediately. And men that are African American and men who have a family history of prostate cancer, or just a family history of enlarged prostate or PSA scores, actually are 2.5 times more likely to get prostate cancer in their lifetime. So we need to start having this conversation now, and we need to be proactive, because we catch it early, diagnose early, it's very treatable, and if it's less aggressive form, but very treatable. We want to catch it early, get the screening going right away.
Yeah, exactly. And you know what I think there's a misconception about, especially just in cancer, is that, oops, just in the last few days I was diagnosed with cancer. It just showed up. And that is not true. It can take up to 10, 15 years for cancer to develop to a size big enough, like a centimeter, where it is visualized on any kind of imaging, where it can change blood numbers, PSA numbers. And so it again goes back to what you're saying, Doc, is that to be proactive in taking care of oneself and reducing our risks. What's also very interesting is that at least 50%, if not more, of prostate cancers are related to 2 types of viruses: Epstein-Barr virus, which is also known as the monovirus, and the human papilloma virus, which is called HPV. And we never hear anything about that. Men don't hear anything about the fact that viruses are linked to prostate cancer. We also don't hear anything about tick-borne diseases being linked to prostate cancer. And so this is vital importance. The other one that I often find is mold. Mold, black mold especially, is highly linked to increased risk of prostate cancer. So if you're living in a home that's moldy, if you've been exposed to mold in your workplace, you know, a lot of men out there who do construction work or are doing HVAC systems or remodels or what have you, you're being exposed to possibly mold, and you may not realize it. And a few years later, as the mold kind of harbors along with the diet of high sugar and alcohol, which feeds that mold and the yeast, then you're getting set up for prostate cancer. Viruses, HPV is a very common virus related to cervical cancer in women, and we talk about that a lot, but again, we don't talk about it with men, and oftentimes HPV is not even screened for men unless they have a partner who's positive for HPV, and then they get screened, but otherwise it's not a routine screening. And then mono, how many of us had mono when we were teens or young adults and got sick, and it may have lasted a week, it might have lasted 4 weeks, and then we kind of brushed it to the side and just kept going and have never been rechecked to see what the Epstein-Barr virus titers are doing in the blood. So these are some things that I would suggest making sure that if you're a male over the age of 35, 40, and especially with a history of prostate cancer in your family, or you're Black, like Dr. Newell said, or you have low testosterone levels, that you definitely get the Epstein-Barr virus checked in your blood, and then the HPV virus, and then look for mold reactions or mold toxicity in the blood, including mycotoxins, which are the toxins released from mold, as well as tick-borne infections. If you're an outdoor person, and you know, many men out there tend to be cyclists or hikers, campers, outdoor, and then a few years later they suddenly get sick and they don't know quite why. And it can definitely be related to a mosquito that was carrying some of these infections that you picked up unknowingly, or a tick that you might have picked up and it might have just tapped you and fell off and passed on some infection. So some of these things we may be unaware of, and it is vital for men to get to bring these up to their doctors and have it be addressed and checked.
Absolutely.
So what else do you have to share with us, Doc?
So going back to the just basic lifestyle things, foods to help reduce risk of prostate cancer. So we want, ideally when my male patients come in, I want to try to aim for a healthy eating pattern. And what does that look like? Well, at least eating 5 servings of fruits and vegetables every day, especially the dark leafy greens. We want to limit our consumption of inflammatory foods like red meat, beef, pork, stuff like that. Things that create more inflammation in the body. We want to try to limit our consumption of those. I always encourage people to consume healthy fats, good fats, like such as olive oil, almonds, walnuts, pecans, avocados. All those contain good, healthy fats. And that's not only going to help reduce the risk of prostate cancer, but it's also just going to create a general wellness in the body and prevents you from possibly getting other pathologies as well. Yeah,
for sure. And blood sugar regulation is really important, right? So it's not just about what you're eating, but the timing of your meals. If you're going long periods of time without eating and you're skipping, lunch, you're having breakfast and then skipping lunch and then having dinner, and you're under a lot of long hours of stress, then you're basically causing what's called insulin resistance and changes in blood sugar patterns, which you may not be aware of again, but it is causing a low-grade inflammation in your body. So sleep becomes really important. Balancing the blood sugar, regulating your blood sugar and insulin, and eating habits, when you're eating and what you're eating, like you mentioned, is going to be very important. And then just general stress management, getting out there and exercising, meditating, breathing. We forget to breathe.
Yeah.
Under stress, right? I mean, do you feel yourself doing that right now? You forget to breathe.
Yeah. I just took a deep breath for the first time. I didn't realize I was holding my breath for 40 minutes.
Yeah, right. So when we go into that sympathetic reaction mode, nervous system goes tight, we stop breathing. A lot of systems that are involved in naturally healing and regenerating the tissues kind of stop. And that is another way that inflammation builds up, and over time cancer sets in. So breathe, and breathe.
Yeah, absolutely. Breathe. It's a good reminder.
It's a good reminder for all of us. It's mindful breathing.
Absolutely. Mindfulness is a big part of it. And this is starting that conversation, right? And it's all goes back to that.
Yeah, it all goes back to that. Yeah.
Going into a little bit more of the therapeutics, I was doing quite a bit of research on vitamin D, and I know me and you have chatted about this quite often. But there was a study posted, I want to make sure I get this right, study posted on the Journal of Clinical Oncology that suggested that low vitamin D levels may help predict aggressive prostate cancer. So the study actually looked at 190 men, average age was 64, who had their prostates surgically removed. After surgery, 87 of the 190 men were found to have more aggressive forms of prostate cancer, actually had low levels of vitamin D. So there's some kind of interesting link there. We may not fully know. There's got to be more research on it, but I think that's fascinating.
It's fascinating. Well, vitamin D is a hormone, right? Yeah. And we know that low vitamin D levels derive low testosterone. So you can fix your testosterone as much as you want, but if the vitamin D is not addressed, you're going to have a hard time balancing out those hormones. And for many other cancers, vitamin D deficiency has been linked. And even, we're seeing some of the media out there discussing vitamin D and COVID risks. I should say vitamin D deficiency and increased COVID risk. So vitamin D is vital for immune system response, as a hormone to balance other hormones, blood sugar regulation, stress response. I mean, the list just goes on.
Absolutely.
So, and what's not often known is that here in the Northwest, even on sunny days in the midst of the summer, we still don't get enough vitamin D because the angle of the sun is not hitting our skin at an appropriate level to shift the vitamin D into the active form that our body can use. And this is a problem from 45-degree latitude and upwards. So even northern Florida, northern California have vitamin D deficiency issues because the angle of the sun is not right for the transformation. So that's one of the things that I'm sure you're giving out a lot at the IV lounge here at Holistique is vitamin D shots, right?
Oh, absolutely. Yeah, we have our vitamin D shot. It's called Liquid Sunshine. We're getting about 25,000 IUs of that shot. Yeah, this is the perfect time of year to get it.
Yes.
There's a good, 5-6 month period here in the Pacific Northwest where we're not getting that vitamin D that we need.
Yeah.
Essentially, everybody that we run vitamin D on, nearly everybody's deficient. And this leads to other issues in the body, as we've kind of been talking about.
Yeah, vitamin D is super important. And the injections I love because the injections bypass the gut. And so we know that some bacteria that are not so healthy for us harbored in the gut can feed off of vitamin D in a sense. Their DNA can bind to the vitamin D and transform or increase their replication. So when you're taking oral form of vitamin D, you may actually be feeding the bad guys in your gut. And then when you get the injection, you're bypassing that and getting to the cells where the cells really need it. So that's one of the reasons I love doing the vitamin D shots. Also because you don't have to get it often, right?
Yeah,
it's not
exactly.
like a B12 shot. It's a fat-soluble vitamin that sits around for weeks in your blood, and you may not need it as frequently as like a B12 or any other vitamin shot. So it's an easy, quick fix. And it also reduces your risk for cancers, period, right? Doesn't matter what cancer you're trying to prevent, man or woman, you're reducing your risk. And you're optimizing your immune function against the viruses, especially during this season where we've got a lot of them running around and
absolutely,
potentially affecting us.
Yeah, and I actually want to talk about one more fat-soluble vitamin, vitamin E. Specifically, the study I was looking at, gamma tocopherol, actually was shown in the study to inhibit the proliferation or the growth of some of the prostate cancer cells. So something interesting to look at. Relatively new research in that area.
Yes.
Definitely need more research to confirm that, but fascinating.
Yes, and the gamma tocopherol is highest in the seeds of the annatto plant or annatto berries, and that is a tree from South America. And we are now able to extract that and have a pretty concentrated amounts in it. We carry that in a product called Tocopure, which is all gamma tocopherol, and the studies on it are pretty incredible for both prostate cancer, breast cancer, and many other cancers, especially hormone-related cancers.
Absolutely. So there might be something to that fat-soluble vitamins. Yeah?
Yes, because vitamin K is also an important one, especially for bone health, but also cancers. So
Absolutely.
definitely vitamin E, and A is another one that is vital for immune health. I mean, A is important for the gut health, the sinuses, the immune system is in the gut. 80-90% of it is found in the gut. So as long as we can keep the gut healthy, and a lot of times we can be deficient in vitamin A, and that is one of the reasons why the gut may not be so healthy. And or the immune system, maybe we can, when we optimize the vitamin A levels, we're optimizing immune function. But we have to be careful with vitamin A because too much of it can cause liver toxicity. So you do really want to be careful with the vitamin A. Also, beta carotene levels need to be checked, especially in smokers. We want to be careful with supplementation with beta carotene, vitamin A, because there is some evidence, it's not really conclusive completely, but there is some evidence that vitamin A or beta carotene can increase lung cancer risk for smokers. So if you're a smoker, you just don't want to go pick up vitamin A and start taking it. Please do seek a doctor. Well, Dr. Newell, any final words of wisdom before we end this little conversation? No, there's a lot to talk about. I mean, we didn't mention pomegranate, which I love pomegranate, and it's a great thing for men for prostate health. And
that was next on my list, but time is. Can I touch on it real quick?
Yeah, of course.
Okay, great. The study I was looking at, men who had surgery or radiation to treat prostate cancer that had not spread, so stayed confined within the prostate, and who drank 8 ounces of pomegranate juice every day, slowed down the time it took for their PSA scores to double. And then researchers believe that their tumor growth slowed as well. So very interesting study there. One thing I do want to point out, we have to be careful when taking pomegranate juice. Please consult your doctors because it can interact with some medications, but fascinating nonetheless.
Yes, and the other thing to be careful of is pomegranate juice is high in sugar, so it can cause dysregulation of the blood sugar. But one of the things that you can take instead is fermented pomegranate juice, which basically the fermentation causes the sugar levels to go down, and it makes it a much more viable and effective therapy in conjunction with everything else that you might want to do as prevention.
Absolutely.
Yes. So thank you for that. Any other final words before we end this awesome discussion?
No, I just hope this kicks off the conversation and motivates men to take some action in their life and take charge of their health. They first and foremost are in charge of their lives and their health ultimately, but we're here for you. So if you need somebody to talk to, or just somebody to bounce some ideas off of, we're always here to help. So
yes, thank you so much, Doc. You guys need to come and see Dr. Newell to make sure you're on track with prevention. He's living the life and reducing his risks. So he's a great one to have some of these conversations with. There is a quick question on Facebook before we end about Hep C and prostate cancer. And again, viruses do increase your risk for prostate cancer. So if you are fighting any kind of chronic viral infection, it is best to come and see one of the holistic doctors to really evaluate your risks and see what we can do to reduce those risks, to reduce the viral replication load in your system, and to optimize your immune function and well-being. Again, just a reminder that these lives are for informational purposes only. We're not making any claims on any cures for anything. If you have a condition or you're concerned about anything, please do seek one of the providers that you feel you can trust, and we're always available for you here at Holistique. You're welcome to go to holistiquehealth.com and visit us and have a telehealth consult, or an in-person consult. Again, thank you, Dr. Newell, for joining me today. Thank you, men and women out there who have joined me, and let's fight with well-being through this cancer risks and the cancer epidemic that we're facing in our country and in the world today through prevention and love. So thank you again, and we will see you next week, next Thursday, 12:15. I have Dr. Rody joining us next week, and that'll be an awesome conversation. He's all about mental health and well-being, and we're going to be talking about men's health, mental health next week. So join us next week at 12:15. See you all, and have a wonderful end of your week and weekend. Thank you again.
Absolutely. God bless.
God bless.